Okay, so today I'll be doing general pathology of homeopathy. That is the chapter from Stuart Close. It is a very long chapter and it is quite complicating. So I have simplified it for you all, and I'll be giving you lecture on this. So let us see the origin of the word pathology. It comes from the Greek word pathos, meaning disease, and logos, meaning a treatise or a treatise of disease. The definition states that it is a branch of medicine which treats of the essential nature of the disease. That means basically we are dealing with a sub branch of medicine which will naturally deal with nothing else except the disease phenomena occurring in an individual. Or it can also be defined as the study of the cause, that is the etiology, the pathogenesis, that is the evolution of the different types of diseases, and the response of the organism to such a disease condition. So now this is very important. Even from the homeopathic point of view, we have to see what is the cause of the disease. So according to homeopathic point of view, the cause of the disease is not the bacteria, virus, or the protozoa, but it is the dynamic derangement of the vital force. So you have to identify what type of disease it is, whether it's an acute disease, chronic disease, subacute disease, and so on and so forth, and see the cause of the disease. In aphorism number 5, we are getting the cause of the disease. For the acute is the exciting cause or the acute miasm, and for the chronic disease, you are getting the fundamental cause or the chronic miasm, and you are getting the maintaining cause. And also you must see the evolution of the different types of diseases. That means what? How does the disease evolve per se? That means if you take an example of a disease, say example bronchial asthma, how does it evolve? In short, what are the signs and symptoms? So you get in bronchial asthma, you're getting, before the asthma starts, the asthmatic aura, then the asthma attack, and then the end of the attack. So that is fine as far as the disease process goes. But as a homeopathic doctor, we have to see the evolution of the disease. So the evolution of the disease, I will take it up later on, but just to tell you in short, it goes from the dynamic plane to the preclinical or the pre-functional plane, to the functional plane, to the structural plane, and lastly the pathology. So basically, we have to follow this specific link, and we have to find out how does the disease evolve in homeopathy. And naturally, the response of the evolution will differ from person to person, from disease to disease. Now, let us see the branches of pathology. Of course, there are many branches: histopathology, surgical pathology, experimental, forensic, cytopathology, hematology, and human pathology. So basically, from all these branches, we have to focus on the branch of human pathology, which we are going to study. Now let's see the classification. It can be classified broadly into two big groups: the general pathology or the special or systemic pathology. General pathology, it deals with the general principles of the disease. So it deals with the disease on a very broad base, like inflammation, thrombosis, gangrene, so on and so forth. Or special or systemic pathology, it includes the study of diseases pertaining to specific organ and body and system. So whatever system is involved, whatever area is involved, whatever organ is involved, so accordingly we have to identify and we have to study that. Now general pathology, it deals with the diagnosis and management of disease. So as I told you, we see the disease on a very general level. So by seeing the pathology on a very general level, we can come to know what is the diagnosis of the disease and further how to manage such a disease by the use of component of laboratory medicine and even the diagnostic technique, including examination of the patient. So basically, if we have diagnosed a disease, we have to naturally not only diagnose it on the history of the patient or the examination of the patient, but you have to take into consideration the history of the patient, the general examination, the systemic examination, the investigations, and then come to a conclusion what the person is suffering from. Now, special or systemic pathology, as I told you, it is a pathology which occurs in a particular organ, system, or location. it involves different components of study. For example, the etiology, the pathogenesis, the specific diagnostic features, epidemiology, macroscopic and microscopic appearance, natural history, and sequelae. So basically, if you see any systemic disease, you have to study it in a form of the cause, the pathogenesis, or the pathophysiology. Then what are the diagnostic features? What is the epidemiology of that disease in the world? And whatever organ is affected, you have to know the macroscopic appearance or the gross appearance and the macroscopic appearance. And naturally, how does the disease evolve? That is a natural history. And if left to progress on its own, it goes into the sequelae. So what are the different sequelae? That also we have to know. So in other terms, systemic pathology is the clinical aspect of a disease development and presented in each organ. So how does a disease develop and what organ does it affect? It is based on that. Thus, systemic pathology is a tissue-based clinical science. Now, special pathology is further divided into medical and surgical pathology. Medical pathology naturally deals with the internal morbid conditions, whereas surgical, it deals with the external condition. That is, it deals with the removal of the tissues of the living body or biopsy or surgical dissection. Now let us see what is Hahnemann's view on pathology. Now that is also important to understand. Since we are homeopathic doctors, we have to give more stress on this. Number one, we have to understand that it is the dynamic nature of the disease. Life is never static, it is always flowing. Different epochs in one's life it is of importance, and susceptibility plays an important role. Now let us discuss each point a little bit more further for you to understand correctly or properly. Now the dynamic nature of the disease. As you all know that during Hahnemann's time, Hahnemann himself was an allopathic physician. He was quite disappointed by the results of the allopathic medication having side effects and no actual cure were there. But they were just pronouncing cure, but actually cure never took place. So Hahnemann, it led him to think why this occurred, and later on he found out the dynamic nature of the disease, or he invented homeopathy. So he deviated from the materialistic school to the dynamic school. So the materialistic school said that the disease was because of some organism or some material present in the organism. That is the materia peccans, or the prima causa morbi. That is the primary cause of the morbid disease, or the causa chronicorium. That is the chronic cause of the chronic disease. So he deviated from there and said that the disease is not because of a virus, bacteria. It is because of the dynamic derangement of the vital force. And with that, he has also put susceptibility, which plays a very important role. So until and unless you are susceptible, your vital force will not get deranged. So prior to that, what has been deranged? The susceptibility. So you have to be susceptible. Then only the bacteria, virus, or the organism, or the material peccans will enter the body. It just doesn't enter the body like that. So therefore, he says you have to understand the dynamic nature of the disease, that the vital force is there. It is in harmony with the body or the physiological processes of the body, as the result of which health is maintained. So health is maintained because of equilibrium of all the different processes going on in our body, like respiration, anabolism, catabolism, excretion, secretion, etc. So if all this is going on in tune with if all the systems of the body are in tune with all these different physiological processes, then naturally everything will be fine. The person will be in a state of health. Moment a distunement occurs, or an equilibrium is lost, or the vital force is deviated, then you get a disease condition. So at one end, you're getting health, opposite end, you're getting disease. Health is where the vital force is in equilibrium. Disease is where the vital force is in disequilibrium. Health is absence of signs and symptoms. Disease is presence of signs and symptoms. And health, homeostasis is maintained. In disease, homeostasis or the internal milieu is deranged. So this is the dynamic nature of the disease. Second point, life is never static. It is always flowing. Like everything in this world, or the world is there because of the universal force which gives life to everything on this earth. Therefore, we are living, all living things are flourishing on this earth. All animals, all plant life, and including the human life, we are flourishing. So you go to see that's the sort of an energy which is never static. It is always flowing. It is always flowing, as a result of which we say that life is never static. Why? Because in our life, there are different epochs in one's life, which is important. We do not stagnate after we are born. We do not remain small. No, we start growing. So from an neonate, we come to an infant. From an infant, we come to a child. From a child, we go to adolescent. From adolescent, we come to adult. From adult, we go to old age. So you can see life is never static. It always moves on. Similarly, the vital force, or as Kent said, the influx, it is never static. It always moves on. So the influx is there in the body, as a result of which the life is there, as a result of which we are alive. So anything which disturbs the influx, like the environmental causes, that is the physical, chemical, biological, and psychosocial, cultural causes which affect the individual, as a result of which the person gets deranged. So therefore we say life is never static, vital force always goes on flowing, susceptibility always also goes on flowing. So now what do we have to, in this dynamic nature of the disease, what do we have to see? Basically, we have to see the evolution of the disease. So the evolution of the disease will be got from the evolutionary march of events, right from the patient's birth till the patient dies, or till the time he's come to see you. So you have to see the different epochs. Different epochs meaning what? You have to see, you have to ask the patient, is there, was there any problem during the delivery? What was the mother's state of mind during the delivery? Because that is also very important nowadays. People are giving great importance to it, because the mind plays a very, very important role, as a result of which the child could get affected. So if the pregnancy was unwanted, if the mother had tried to abort the child but was unsuccessful, then what happens when the child grows up? You will find child is very dissatisfied, he is antisocial, he is very aggressive, so on and so forth. So therefore, this study is very, very important nowadays. Then we have to go to the delivery. Was it a normal delivery? Was it a cesarean section? Then, or was it a vacuum or a forceps or whatever it may be? And what are the consequences of such a delivery? What was the birth weight of the patient? All the milestones were normal, or they were delayed, or they were early, and then later on, when did the first teeth appear? When did the person started crawling, walking, talking, so on and so forth. So you can see the different epochs are there. In females, an important epoch is the appearance of menses, that is menarche. At what age, any problem during that time, and later on, menopause also is important. So you are seeing these are the different epochs which we have to take into consideration to identify the dynamic nature of the disease, or the evolutionary march of events. Now, health and disease. In health, equilibrium is maintained. There is order and harmony. Homeostasis is maintained. It's a word coined by Alfred Cannon, and internal milieu is a word coined by Claude Bernard. So out here he says, as I told you, health is a state of equilibrium where the vital force is in harmony with all the physiological processes in our body. So basically, there is order and there is harmony, or there is equilibrium. So in our body, we say homeostasis is maintained if the psycho-neuro-endocrine axis is working in harmony with each other. So therefore, Alfred Cannon has said that if the psycho-neuro-endocrine axis, or the PNE axis, is in harmony, then we say that the homeostasis is maintained. That is what health is maintained. That is what equilibrium is maintained. That is what order and harmony is maintained in the body. Now, Claude Bernard, he gave a different dimension to it. He said, he gave the word internal milieu. Internal milieu meaning what? It means the processes which go on in our cells between the extracellular fluid and the transmission of sodium, potassium, and other important elements or other important constituents which maintain health in our body. So that is known as the internal milieu. So if all the exchanges of all the different elements of sodium, potassium, chloride, etc. are going on properly in our body, the internal milieu is maintained. That is nothing but health and equilibrium. So let us see now the total opposite or the other end of it. In a disease state, there is disequilibrium, disorder, and disharmony. Homeostasis is not maintained and internal milieu is in a chaotic state. So naturally, when does the person become into a disease state? We all say that when the vital force is deranged, the person comes into the disease state. But let us see a little bit more what is the factor responsible for the disease state. So initially, the individual is there, he is bombarded by or rather we are bombarded by our environmental factors constantly, again and again, but in our walk of life, right or not? But we are all maintaining a good health. So why are we maintaining a good health? Because the vital force is strong enough to oppose the noxious influences in the atmosphere, as a result of which everything is fine. But moment the vital force gets deranged. So why does it get deranged? Because whatever adaptation is there, that is very important. We are adapting, our vital force is adapting ourselves to the external environment. So as long as it can adapt itself to the external environment, health is maintained. But what happens when you are bombarded again and again by the same thing again and again? What will happen? Naturally, fatigue will set inside and the vital force will not be so strong enough to repulse the noxious agent. So what will happen? The adaptation will be lost. So once adaptation is lost, the vital force succumbs and it gets deranged, as a result of which the equilibrium is lost. So therefore, failure of adaptation, I repeat, failure of adaptation is an important factor or the important landmark wherein we go from a healthy condition into the disease condition. Therefore, in disease we say that there is a disequilibrium. Why? Vital force is deranged. Why? Because there is a failure of adaptation. So therefore, we get disequilibrium, disorder, and disharmony. See, it is exactly the opposite of health. In health, there is equilibrium. Disease, there is disequilibrium. Health, there is order. Disease, there is disorder. Health, there is harmony. In disease, there is disharmony. And the homeostasis is lost. So what happens to the PNE axis? It goes into chaos, or it goes into an improper functioning. As a result of which, what happens? The internal milieu, also there is a disturbance there, as a result of which homeostasis and internal milieu is affected. Therefore, we say that a person comes into a disease state. So change in state of an individual, it goes from the dynamic plane to the pre-functional plane to the functional plane and the structural plane, that is the pathology. So therefore, we have to see the evolution of the disease, how the disease evolves. So it goes from the dynamic, pre-functional, functional, structural, and the lastly will be the pathological stage, wherein pathology could be either reversible or irreversible. Reversible meaning what? In the early stages, if the patient comes to us, the pathology is reversible. But if he comes to us in the later stages, then it may be an irreversible pathology, or the patient hasn't taken into consideration any treatment. He has just prolonged the disease, and when it has advanced to a great level, he has come to you. Therefore, the pathology is irreversible. Kent says it is the end product of disease. So now let us just, before going to this evolution, let us just let me just tell you something about the disease. Now, can we diagnose a disease at the dynamic level? Definitely not. But in the dynamic level, we can identify a disease through special processes which are known as dowsing or radiesthesia or the psychometer. This I will tell you later on. Then after that, we come to the pre-functional phase in where, or the preclinical phase in where the vital force is deranged and we get a few signs and symptoms, but they are very common in nature. So the pre-functional phase then goes into the functional phase, that is the prodromal phase, that is nothing but an indisposition, and later on goes to the pathology. Now this I will discuss later on as we move forward. Okay, so Kent says it is an end product of disease. Now in evolution, let us see the disease, what type of evolution it has. As I told you, we have to see the evolution of disease right from the birth till the death. That is the sequential evolutionary march of events we have to see. Now that is one part. Now this is a second part. Disease has a centrifugal evolution. That means what? The cause of the disease originates from within. Within meaning what? From within the individual. It is not external. So a true chronic disease or a true disease will develop from within. Now within meaning what? What is the cause which is within the individual? That is nothing but the miasms. So the miasms are responsible for the disease to develop. As Dr. Hahnemann said, that Sora is the hydra-headed monster and it is the mother of all the chronic diseases. And Sora passes from generation to generation, and each one of us has Sora. It is never mitigated. Why? Because of the faulty suppressive treatment taken over all these years. It is passed from generation to generation. So Sora is there, but all of us, we are in a good state of health. Why is it so? Because the soric miasm is lying dormant, is lying slumbering, is lying quiet in an individual, or basically it is in the inactive state or inactive stage. What happens when the disease occurs? The miasm, which was slumbering, which was latent, which was in the inactive state, it comes into activity. It's just like a volcano. No? When a volcano is there, it is quite, when it doesn't erupt, when it is dead, it is quite okay. But moment it erupts with great intensity, as a result of which the lava comes up and the destruction takes place. So therefore, acute disease can be compared to an volcano, wherein we have to see, are there any miasm responsible for it? Naturally, for all acute diseases are because of an acute miasm. So this acute miasm will be slumbering in a patient, in a person. Under favorable environmental influences, it gets activated and the signs and symptoms come back, or they are exhibited. So just like a volcano, when it is dead, it is fine. But when it starts or when it erupts with great intensity. This intensity can be compared to the acute miasm. That is what, when the acute disease, it gets exhibited or it's expressed through signs and symptoms, the symptoms are generally very, very, very characteristic of PQRS in nature. Okay, so therefore, in an acute disease, it becomes easy for us to prescribe because number one, symptoms are characteristic in nature, and number two, the less time is required to trace the picture of the disease. Why? Because the point number three is that everything is fresh in the patient's mind, and it is of a recent origin. So therefore, acute miasms can be recurring or non-recurring. Non-recurring, our examples are given in Organon text, like once you get measles or smallpox, then the immunity is there. That is the non-recurring, or recurring are malaria, typhoid, jaundice, so on and so forth. Whereas in a chronic, so in an acute disease, basically, we have to identify the acute miasm and limit ourselves to the acute presentation only. We don't have to go into more details, except that take the acute presentation, take the chief complaint or the presenting complaint of the patient, and then you analyze it into the LSMC form. That's all. And then we have to prescribe. Dr. Hahnemann says, do not go further than that. If you read Stuart Close, Kent, Everything, if you read, also it says the same thing. Whereas for a chronic miasm, we have to see the fundamental cause of the disease. That means what? Fundamental cause is obtained from the predisposition of the patient. That is from the family history supported by the past history. So the fundamental cause is the inherited cause which nourishes the chief complaint of the patient. So Dr. Hahnemann says in episode number 5, in fundamental cause, identify the chronic miasm. Not only that, see the patient's age, mode of habit, mode of living, his habitat, his food, his aversion, his craving, his sleep, his dreams, his mental state, etc., etc. So you can see, to identify a chronic disease, it takes much longer time because number one, it is chronic in nature. The patient doesn't remember all the complaints properly, and it takes a long time to trace the picture of the disease. So therefore, as compared to an acute disease, a chronic disease will take much more time. Okay. Whereas, so therefore we say that the disease evolves from within outwards. That is centrifugal. Centrifugal force is what? Which goes from within outwards. Whereas the disease expresses itself centripetally. That means what? It will go from the skin and it will go into the more important organs. That is, it will go from the periphery to the center, or from the skin to the mucous membrane. That means what? The disease will first express itself on the skin. If suppressed, it will go deeper, 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 layer by layer, and lastly affect the most vital organs. So it goes on the skin, mucous membranes, serous membranes, and the vital organs which gets affected. So remember, the expression of disease is centripetal. Okay. So now we can stop out here. I will take this in the next lecture, because this again has some more time. It will take some more time to do it. So in my next lecture, I will share it with you.